Well, welcome to this talk. I've entitled this talk An Introduction to Functional Medicine, From Surviving to Thriving. So if you or a loved one are really in a place where you are struggling to survive the day or the week or the hour, and really want to move into more of a thriving feeling, this talk is for you. So I want you to take notes and get ready, and we're going to dive in. So before I begin, I really just want to tell you a little bit about me. So my name is Cassie Krause. I'm a nurse practitioner. A little bit about my background in education. I graduated in 2006 from Midland Lutheran College. It is now Midland University. Graduated with a Bachelor of Science in Nursing. Since that time, I worked as a registered nurse at Nebraska Medicine. In 2012, I went back to school and graduated from the University of Nebraska Medical Center with a Master of Science in Nursing. And since that time, I've been practicing as a family practice nurse practitioner. My entire experience as a nurse practitioner has been in primary care. Just love primary care, love being a central healthcare provider to anything that anybody would need. In around 2016, I really started developing an interest and a love for integrative medicine and functional medicine. And really what that does is it brings in a more holistic, a more natural approach to things that we can do to help people. I was just enamored and amazed at how effective it was and how safe it was to really emphasize some natural treatments that we can do to help people. So I'm currently enrolled in a certification program through the Institute of Functional Medicine and plan to complete all of that by the end of this year, by the end of 2020. In 2019, I opened my own practice, my own private practice, where I'm providing holistic primary care services and functional medicine services. So I think before we really dive into this, we really need to define what is functional medicine. So if you are thinking, I don't even know what functional medicine is, you are not alone. If you would have asked me that question 10 years ago, I wouldn't have known the answer to that either. So the term first came around in the 1980s and 1990s. It was really coined by Dr. Jeffrey Bland. He is a biochemist and really is considered one of the founders or one of the fathers of functional medicine, if you will. He's also the co-founder of the Institute of Functional Medicine. The essence of functional medicine is really we focus more on the patient than we do the disease that we're treating. It's really heavily based on evidence and research. We look at the body as really the body and how it functions, as each part is so important. No one part of the body is more important than the other, and they are all interconnected to each other. We also believe that the body and how it functions can be changed based on our genes that we have, based on our lifestyle, and based on the environment that surrounds us. We really strive to understand why or how the body got to where we are today, and we try to go back and look at, are there any underlying imbalances or any underlying things that are affecting our body that can promote dysfunction and subsequent disease? So can functional medicine really be combined with oncology care? So I recently did some continuing medical education from the University of Arizona College of Medicine. The class was called An Introduction to Integrative Oncology. So really to define what is integrative oncology is really conventional medical treatment that we would see day in and day out, but really we team that or combine that with some mind-body medicine techniques like meditation, relaxation, massage, nutrition counseling, and maybe even acupuncture. So why would we want to do that? Why would we want to team integrative oncology, or why would we even want to think that that's a good idea? And really the goal of integrative oncology would be that we would enhance the effects of our conventional cancer treatments. We would want to reduce the side effects. If you or a loved one is facing cancer or has gone through cancer, you know that the side effects can really be devastating. We want to improve overall cancer symptoms and enhance our emotional health in how we're dealing with the diagnosis we've been given. We also just want to improve the quality of life and promote the best outcome for the patient. patient. So I want to touch a little bit on the World Cancer Research Fund. If you're not familiar with them, they're a not-for-profit organization. They, again, rely heavily on evidence and research. They have power and influence, really to influence policies at some of the highest levels that we see. Their vision is just incredible, and I love it. It was so quote-worthy that I'm just going to quote it here. The vision of the organization is we want to live in a world where no one develops a preventable cancer. And really 30 to 50% of the cancers, the most common cancers that we see, are preventable through diet, nutrition, and physical activity. In 2007, the World Cancer Research Fund teamed up with the American Institute for Cancer Research and really developed 10 recommendations for cancer prevention that was all based on the research they had up until that time. They continued to look at the research and evaluate how patients did when they followed these recommendations. They ended up updating the recommendations most recently in 2018 to really be a more holistic view of the previous recommendations. They're very much the same, and we're going to get to those in a minute, but it's just more holistic, and it's definitely a lifestyle approach. And really what they found is that the closer people followed these recommendations, the lower overall risk of developing certain types of cancers. And for people who have already been diagnosed with cancers, the closer that they followed these recommendations, they had a higher rate of survival. So here they are, and this is a great slide, so just tune your attention to that. The 10 recommendations that they came up with for cancer prevention are: be as lean as possible, be a healthy weight. So really it's less about your BMI, but it's also about the amount of fat content that you have in your body that they saw as being very important. So be as lean as possible and still a healthy weight. Be physically active as best you can as a part of your regular everyday life. Limit foods that promote weight gain. And those could be things like sugary drinks or heavily processed foods. Eat mostly plant foods. So those are all those vegetables in all those different colors. Limit intake of red meat and avoid processed meats. Limit our alcohol consumption and limit the consumption of salt and processed foods. Do not use supplements for cancer prevention. And that's important because really no one vitamin out there that we know of can prevent cancer at all, especially if we're not doing 1 through 7 very well. And number 9 would be for mothers, if you have the ability, breastfeed your baby if you can. And number 10, after a cancer diagnosis, they really recommend you to follow these recommendations as best you can. So let's tie all this into what does this have to do with functional medicine and how can functional medicine help with this? So I really just wanted to walk you through what is a typical office visit like with a functional medicine provider, with somebody like me. So really a clinical timeline, which is a slide on your screen, this is really going to walk through, it's going to help us walk through a patient's symptoms. So we're going to start in the white box closer to the right side of the arrow there on what your current symptoms are. So what brought you here? What are you facing today? And then really we move backwards. We look at what are things that are surrounding your health even before you were born. What was your mom's health like when she was pregnant with you? Then we go forward. What were significant life events that happened to you? And they can be emotional events like a divorce or the loss of a loved one or the birth of a child or a serious illness. There can be lots of things that can affect our physical health and how we feel. And then we look for triggering events and mediators. So triggering events would be something we could see, as soon as this happened, then I started developing these symptoms. So we start to look for, are there any correlations with that? And then mediators would be things that really allow our body, if our body is in a state of dysfunction, mediators would allow or perpetuate that to continue. So those might be things like a diet that is deficient in some common nutrients that we need, or maybe a lack of physical activity. So we look at the timeline. And next we would look at a functional medicine matrix. So on this slide, I'm going to start on the left-hand side in the yellow boxes, and really I'm going to move down, and then we're going to move into the white box. So I know it looks like a lot, but hang in there with me. So really, we're going to start with first just retelling the patient's story. So it looks like these are some things that maybe predisposed you to getting where you're at today. So maybe those are genetic things. Maybe these are things that happened before you were even born. These are maybe some triggering events that we see really where your health shifted during this time. And these are things that we think are continuing to allow things to go in a direction we don't want them. And then on the bottom of that yellow square rectangle, if you will, that is just really the most important piece there. Those are the modifiable personal lifestyle factors. And these are things we dive in for sure really at every visit we do in functional medicine. So the first one is sleep and relaxation. Relaxation, I'm really going to team more with stress. So sleep, we really ask, how is your sleep? How many hours of sleep do you get? Is your sleep restful? Do you wake up and feel great in the morning? Because you should. So we address things like, are you sleeping okay? Are you falling asleep? And really, if you're not, those are things we address. The next box would be exercise and movement. So again, we know that even physical activity can help prevent certain cancers from coming. So we look at, are you exercising? Are you able to exercise? Are there certain exercises you like to do or don't like to do? Is there anything that's preventing you from exercising? So we really try hard to look at how can we get you active or keep you active. And then nutrition. Again, I can't emphasize enough how important nutrition is and the things that we put in our body on an everyday basis. So we're going to just start with a typical diet history. What are you eating in a typical day? What are you eating in a typical week? How many meals of fast food are you eating or sugary drinks are you taking in? That gives us an idea of some interventions and things that we can do to help promote overall health. Stress and relaxation. So if you're facing cancer, you are under stress, no doubt about that. So really, we start to look at, are there other stressors that you are facing? And how are you handling that? It's so important that really we look at that because we know that stress affects our physical body and how we're able to take care of ourselves. And lastly, relationships. So we really know that you need a support system around you to help you through this battle. And now we're going to move into the white box here. And this is really more for functional medicine providers where we look at, these are what we call nodes of the matrix. But I'm going to go through these quickly. These are very similar to our different body systems that we have. Again, we view everything as interconnected and we need everything to work well if we want to feel well. So the assimilation node, that would be things like digestion and absorption. Are you absorbing your nutrients? Your energy node, that is a bigger discussion than just tell me how much energy you have today. It's, are the cells of your body, are the mitochondria at a cellular level, are they working appropriately? Is your transport nodule working? Is your cardiovascular system working as well as it can? So we look at all of these key pieces in a functional medicine visit. So this slide too is probably one of my favorites. It is called the functional medicine tree, and really the top of the tree are flowers and really just how beautiful the limbs are just so beautiful, especially this time of year. But they represent all the different body systems. And really, if you look way down at the bottom of that slide, what are the roots of the tree? The roots of the tree are those personal modifiable lifestyle factors that we just went over. So things like sleep and exercise and nutrition and stress, those are foundational. If you want to have a healthy tree and have all of the organs in your body working well, we really need to have a solid foundation of a healthy lifestyle. In functional medicine, we might do some advanced testing too to go along with some standard labs that we would draw. And some of those things might be things like we would do a stool analysis to really look at, is there any inflammation in the gut? How happy is the gut? What does the microbiome look like in the gut? We might look at nutrients, things like vitamins. Are you getting enough? Is your body able to absorb them? We might look at food intolerances or environmental things that could be impacting your health. We might look at adrenal function and how your body's functioning. We might look at toxins like toxic exposures. If there's anything that your body is being exposed to that your body doesn't like, we want to know about that. And then sometimes we look at hormones as well. So after we gather all of this data in a functional medicine visit, really we create an individualized, holistic plan. And really, what are the things we're going to start with in terms of our recommendations? They are going to be those lifestyle interventions that we just talked about. So again, nutrition. What should we be eating? What should we not be eating? What do you like to eat? Sometimes I hear people say, Cassie, I don't do vegetables. I don't do broccoli. Well, I bet when you take a pill or a medicine for your blood pressure, I bet that doesn't really taste good or you like it. So sometimes we have to change how we view food, change how we view food in terms of not just the goal of it being pleasurable or enjoyable, which that is one of the benefits of food, but really we want to look at food as medicine. Food can be our medicine in terms of getting enough nutrients. So when I tell you to eat that broccoli, if you can, that's really because I see that as being beneficial to your overall health. Exercise. What can you do? What do you want to do? Again, do we have anything impacting your ability to exercise? If we have arthritis and some knees that bother you, we might recommend some aqua therapy or some water therapy to be careful about those joints. And again, sleep. We want you to sleep well. And stressors. I heard recently a functional medicine neurologist ask one of my patients about her stress resiliency practices. So he asked her not only just what stresses are you facing right now, but what are you doing to help your body practice being resilient to stress. So I think that's very, very important that those are tools, much like an athlete who probably couldn't run out and run a marathon today, but maybe that athlete would have to train and practice so that he could do that someday. Same thing with stress resiliency. There are things out there that you can do to help your body learn and practice to be more resilient to stress. We might recommend some interventions based on the labs that we did. So if we find any infections, we might treat those. If there's some vitamin deficiencies, we might recommend some. Really, the goal is to restore balance to the body's functions. We want every organ system to be working well. And then we're going to watch and see how you do and reevaluate the plan as we go. So does functional medicine really work? I think that's a key question. And so there was a recent study that was published in 2019 in the Journal of the American Medical Association. They looked at 7,000 patients. And of those 7,000 patients, 1,500 were treated in a functional medicine model, and 5,600 were treated in a traditional family practice model. They gave all of the patients questions, and they really reported their health and how they felt their health was. And patients who were treated in a functional medicine model of care were more likely to report a clinical meaningful change or an improvement in their health, evidenced by their scores going up by 5 points or more. And these positive health changes really they saw lasted up to 12 months, which was the length of the study. So the study conclusion really states that the present study suggests that the functional medicine model of care may have beneficial and sustainable associations with an improved health-related quality of life scores in patients, and they could improve chronic disease management as well. So I want to give you an example of a patient that sought out integrative or functional medicine to coincide with her conventional oncology care. So this patient, she was an 80-year-old lady. She was diagnosed with metastatic breast cancer. She presented to her physician's office with a lump in her right breast. It was found to be cancer. Subsequently, they found cancer in her left breast as well as some of her surrounding lymph nodes. She also sought out an integrative medical team to to really receive care in addition to the conventional treatments that she was getting. Her medical history up until this point, she was on some medicine for high blood pressure, for heartburn, and for her thyroid. Her oncology team recommended that she have chemotherapy done, and then based on how she did after that, she would probably need a mastectomy as well as radiation after surgery. Her functional medicine team recommended that she follow a low glycemic index diet, which those are things that are going to limit our processed foods and starchy foods, a dairy-free diet and gluten-free diet, making sure that she got enough protein with every meal. They did some additional nutritional testing and found that they put her on some vitamin D, some digestive enzymes with her meals. Sometimes those things can help you digest your food better and your nutrients. They recommended a probiotic, which would help balance the microbiome. They recommended melatonin at bedtime, IV vitamin C infusions, 10 minutes of bicycling per day with a goal of moving towards 30 minutes per day. She was counseled on sleep and was recommended that she attend individual counseling as well as a group support class. So how'd she do? So they watched her over the course of her treatment. They documented her for about 18 months. Really, when she first started to change her diet, she noticed her heartburn got better. So she stopped taking her heartburn medicine. Her blood pressure and her weight came down a little bit, enough to where they were able to stop her blood pressure medicine. She did end up having a bilateral mastectomy and decided not to do radiation. Her blood pressure started to rise a little bit after surgery, so she was referred back to cardiology. During this time, she did document some fatigue and some hair loss during her treatment. After approximately 18 months after her treatment began, she had a follow-up with her oncology team. At that point, they did a complete blood work panel and found her blood work was normal, and she had no signs or symptoms of breast cancer. So the author's summary I thought was really great, so I'm just going to quote it here. Because this is a case report from the real-world practice of medicine, it is not possible to determine the responsibility of the treatments in this patient's success in achieving remission. Nevertheless, the patient survived her cancer with minimal side effects during treatment and is now in her 3rd year of remission. This case study highlights the potential benefits of integrative therapy in the co-management of patients with invasive ductal carcinoma of the breast. So really what he's saying in the beginning there is we don't know really what helped her the most. We don't know what was responsible for her surviving her cancer with minimal side effects, but really she did well. And so they're highlighting there could be some potential benefits in doing this. And again, they interviewed this patient after her treatment was completed. And again, I couldn't summarize it any better, so I'm just going to quote what they quoted her in saying after her treatment was over. This is the patient's perspective. I was worried about the side effects of chemotherapy, but I never had to have a blood transfusion. I only had diarrhea once and no nausea and vomiting. I had a little bit of fatigue, but stayed active and did not have to change my lifestyle very much. I was able to be with my friends and family and to taste and eat food while I was being treated. I thought that I looked better than the other chemotherapy patients I saw when I went to get treatments. They all looked so sick and so much older than me. Remember, she was 80. The worst thing was losing my hair. I knew that the medications had a long list of side effects, and at the beginning, I did not understand that they could be minimized, but they were. I had chemotherapy and surgery, but never had radiation. 2 years later, I am still cancer-free and feel great. I may be healthier now than I was before my diagnosis and treatment. So really, as we wrap up our talk today, really my hope is that this is an introduction to functional medicine and really the potential benefits of how it could help you or a loved one move from just surviving into thriving. I want to quote Dr. Lisa Richardson. She's a physician She's the director of the Center for Disease Control's Division of Cancer Prevention and Control. She states, as an oncologist, when people ask me if there's a cure for cancer, I say yes. Good health is the best prescription for preventing chronic diseases, including cancer. What that means to healthcare providers, like me, is helping people to have the information they need to make healthy choices where they live, work, learn, and play. So oftentimes I'm asked, how do I know if functional medicine can help me? And really, my answer to that question would be, it can help anybody. If you have anything that you feel like, any symptoms that you still have that bother you, and maybe you've tried lots of things to make them better, whether it's fatigue or headaches or stomach problems, if you have continued symptoms, functional medicine might benefit you. If you're not sure, I've attached at the end of my presentation, I've attached what's called a medical symptom questionnaire, or an MSQ. This is a questionnaire that you can complete at home, and it's going to have you rate your symptoms, really from head to toe. You're going to give each system a score from 0 to 4, and then it's going to have you add up your score at the end. And what I find is that if I can get patients to have a total score of less than 20, we're doing pretty well. Oftentimes, when patients first see me, their score is over 100. And the higher the score tells me, the worse you feel in general. So really, those are questionnaires that I give my patients often. We'll do an intervention, we'll try some things, and then I'll have them actually repeat this questionnaire. It tells me what overall improvements did we see, and what body systems got better or what body systems got worse that we still need to work on. So that is a key tool that you could use to see if you could benefit from functional medicine. And I would say the caveat to that is all of the things that we talked about today rely heavily on lifestyle, things that you can do at home. So really what that requires is that you are interested or ready to make a change in some key things that you might be doing, whether it's what you're eating, how you're sleeping, the activity that you're getting. You have to be ready to jump in and make some of those changes, because it's not easy to change what we eat or how we live our life. We tend to be creatures of habit and do the same thing over and over again. So if we can get to a place where we're interested and we're ready to really focus on some things we can do to promote good health or healthy lifestyle, then functional medicine might be able to help you. So I would say the next common question that I get is this covered by my insurance? We all want to be able to use our insurance for our healthcare needs. And I cannot speak for every provider out there or every office. Everyone has different policies and procedures on finances and insurance coverage. All I can do is tell you what I do at my office. So I do accept most of the major commercial medical plans, and those things cover the office visits. And then after that, it's very much an individualized conversation. Some of the testing that we do is covered, even some of the advanced testing. Some of it is not. So that's dependent on your situation, what you need, and what your insurance coverage is on if some of those things are covered.